name is Christian Ocampo. I'll be doing my video validation on PEG tube care for my Nursing Foundations class, section 602. To begin, I'm going to read you off 7 steps that you should do, which is to introduce yourself to the patient, ID your patient, which we have Mrs. June, 28-year-old female. Provide privacy, which is, I have a curtain all around us right now. You want to double check the physician's orders, which is I have done right here. PEG tube care every shift. You want to gather your materials. So we have a tubing kit, which comes with the clean barrier pad, Toomey syringe and a container, some tap water or some normal saline. I'm using normal saline. Stethoscope, pair of gloves. I'm going to explain the procedure to your patient, as well as you want to do some hand hygiene. Alright, I'll begin. Hi, Mrs. June. I'm Christian Ocampo. I'm going to be your student nurse today. I'm going to be taking care of you. I'm also going to be taking a look at your PEG tube, and I'm going to see how that's holding up, okay? Alright, great. To begin, I'm going to raise the bed up, and we're going to elevate it to working level. And this is about good. And then we're going to raise the head of the bed up to about 45 degrees. Alright. This is June. You have any nausea, dizziness? Do you feel like to vomit? No? Good. Okay. Our next step is that we're going to turn off our feeding pump. I don't have a pump here, so it's going to make believe that I do have one. Turn it off. Our next step is that we're going to assess for abdominal distension and check for bowel sounds. Just like so. So the abdomen is not distended. The PEG tube site looks clean, dry, intact. No dressings underneath any of the tape. Then our next step is that we're also now going to assess for bowel sounds. We're going to start at the ileocecal valve, and we're going to go clockwise. For the sake of this demonstration, I'm not going to be listening to each quadrant for a minute, because it's going to take too long. Ileocecal valve, then go to right lower, then right upper, then left upper, and left lower. In this case, everything sounds normal. Everything is giving me active bowel sounds, all 4 quadrants. Our next step is that we're going to disconnect our G-tube, and we'll begin. Before disconnecting, we're going to put on the protective pad because it may or may not get messy. I would put on some clean gloves right about now. We're gonna kink. We're gonna disconnect the feeding tube since it's already since the feeding pump is already off. Kink it, and let's say I disconnect it like so, because you may get backflow, and that's why we have the pad here. So as you can see, I'm kinking it right now. Then we're going to insert our syringe or Toomey syringe. I have a Toomey. And place it right here. Then we're just going to gently aspirate. It should go by itself. You get over 100 mLs of feeding or gastric fluid or whatever. It means that your patient is not absorbing the nutrients adequately. So at that point, you would stop and contact your physician. In this case, let's say that we get 20 mLs of content. Since we don't have over 100, we're good. And we're going to reinstill it after noting color, consistency, and amount. So like I said, we have 20. Reinstill it. Just like so. We're going to kink the tube again. And we're going to get 20 mLs or cc's of tap water. Because I'm using normal saline, I'm going to be using normal saline. I know there's nothing inside, but we'll just make believe.
My name is Juan Jimenez, and I'm going to bed bath. I'm going to start with my 7 steps.
And then we're going to flush it. Just like so.
Wash my hands, gather my equipment.
Slowly.
Myself.
Of course.
What we're going to do, identify the patient.
We're going to kink,
Provide
move our syringe back into the kit. And we're going to reconnect our peg tube back to the feeding. Since, once again, I don't have the pump, I don't have that feeding line here. We'll just make believe that I did. And then we're going to remove it. Like so. Turn on the pump back to its original setting. Cover it. Then we're just gonna wash this. Gonna wash the Toomey syringe with the water that you have. Store in a clean area, so that way the next time you're gonna be doing this, it's already there. It's good for 24 hours, by the way. We're gonna remove our gloves. Hand hygiene once again. I'm going to put the side rope back up since I removed it. So we're going to add any more feeding if need be. So just a heads up, the entire system needs to be replaced every 24 hours. Our next step is going to record our INO and record our notes and the nurse's notes. I'm going to put the bed back down. Put the head back at a comfortable position for the patient. Like that. I'm going to give our patient the call bell light. And we're going to ask if the patient needs anything else from us. So Mrs. June, do you need anything else? Is there anything else that we can take care of for you? No? Great. All right. That's how you take care of a peg tube, guys. Thank you.